Thank you. Good afternoon, everybody. Welcome to this session of MS Focus, the Multiple Sclerosis Foundation's webinar on invisible symptoms. I have with me today a panel of 5 individuals who are living with MS, who are also experiencing some invisible symptoms. And we've asked them in advance to sort of submit some talking points. So the format of this will be sort of conversational. I'll pull some of those talking points in the form of a question and let folks that are online answer them. And then hopefully in about 40 minutes or so, we'll have some time where we can let those of you who are on the webinar watching, either on Facebook Live or on Zoom, to ask any questions you might have of the people who are on the webinar right now. Just a little bit of background. I'm the patient healthcare liaison for the MS Foundation. I'm also an internationally certified MS nurse, and I've been living with MS for close to 50 years now. My first hospitalization was in 1975, but I wasn't actually formally diagnosed until 1994. I live almost on the ocean in Rhode Island. It is gorgeous up here, but very, very hot and muggy. So I'm going to ask each of the panelists to just take a moment, maybe 45 minutes to, or 45 seconds to a minute, and just introduce yourself. You can tell us anything you want to in that short period of time. So we'll start with Barbara.
Hi, I'm Barb Orwick. I live in a very small town in Central Oregon. In the valley I live in, there are approximately 2,000 people, which most cities are bigger than that. And there are about 10 to 12 MS cases that I know of in this valley. So yeah, that's where I'm coming from.
Barb. Jaitrali.
Hi everyone, I hope I'm audible.
You are.
Okay. I come from India. About me, I have been a former digital marketer for 20 years. I have been diagnosed with MS in 2009, and soon after that, I was also diagnosed with Crohn's within a year. And I continued to work because it did not hamper me so much physically. But a few years down the line, I lost my mobility slowly. I took to the wheelchair. I took an premature retirement and chose to take psychology because I found a dearth of psychology therapists, particularly for autoimmune disorder. So I took up psychology and I thought that this was the best thing, that when I can feel it, I'm going through it. I can feel the person, I can feel the client who is also going through such invisible disorders. It's very easy for me to validate them because I'm going through too. So that is about me. My mission is to just share whatever I know, just create awareness through such kind of panels, discussions, meetings, and I have also written a book recently which just got published last month. It's called Scars and Strength, which talks about my entire memoir. And I have given a therapist view of how everybody can tackle with such kind of disorders and ailments. It's not the end of the world. There is still a tomorrow, and we can always, if we choose to open another door, we can. So that's about me. Thank you.
Thank you. Jamie.
Hi, my name is Jamie Colvett, and I live in Lower Slower, Delaware, a town called Milton. I was diagnosed on July 4th, 2000, and I've been living with MS for 25 years now. I have relapsing remitting. Most of my I would say most of the time I've been very, very lucky and healthy. I am mobile. My MS is very invisible to other people, largely with neuropathies and extreme tiredness, you know, the usual stuff. I run the MS support group called the Shore Group, which has been in existence well before me, and we try to keep it up and keep in touch with people and keep people informed. My biggest, I don't know, challenge is to keep people involved, and that it's not, again, the end of the world, and that we have ways to help each other out and direct people to getting information and involved in the MS community so they become well informed about their disease.
You. Didi.
Hi, everybody. My name is Didi. I have been living with a rare subtype of multiple sclerosis called tumor-affective multiple sclerosis. I was diagnosed in March of 2018. So I've been living it for about 7 years. And throughout this whole journey, my goal is to educate, advocate, and spread awareness, not only about multiple sclerosis, but also about tumor-affective multiple sclerosis, since it's pretty rare. And I want to share a fun fact about me. Everybody knows, like my friends, family, colleagues, they know I love sugar. I can eat a whole box of donuts if I wanted to, but I wanted to share that about me. But yeah, that's all.
Didi. Dan.
Hi, I'm Dan Digmann, and I live in Mount Pleasant, Michigan. And I feel like I need to start a special club with Jamie because I was, as far as like special holidays in and of themselves, I was diagnosed on Valentine's Day in
Oh.
2000, so 25 years. So yeah, you say on 4th of July. I live with an invisible, a lot of the invisible symptoms and everything. I continue to work full time and work remotely, and I've worked remote before it was cool because I've been remote since 2018. I'm married to my wife Jennifer. In September, we'll celebrate our 20th anniversary, and Jennifer also has multiple sclerosis. She has a more progressive form of the illness, and so that's something we always discuss is like, with her visible, using a wheelchair and I just walk, and if you didn't know I had MS and I didn't talk about it all the time, you wouldn't know I had the disease. And so that's where I'm at, and I'm looking forward to talking more about this with everybody else here today.
Thank you. I'm seeing tons of things popping into the chat. I'm with Didi Donuts. So, you have a lot of compatriots out there. One of the things with invisible symptoms of MS that I have found difficult to deal with at times is that people sometimes don't take me seriously. If I say, I don't feel like I can do that today, or that seems like a little bit too much time to commit in that environment, too many people, too much heat, that sort of thing. And my experience has often been that people will argue with me. Oh, come on. You can do this, or you can do that, or you're just making excuses, or people might come back with I think Dan brought up in his talking points a very good point that they try to one up you. You want to just kind of address that issue, and feel free to just pop in. I'm not gonna just if it's something you want to add to the conversation, I'm not gonna make everybody answer a question, but please feel free to weigh in on that.
Can I? I'm sorry, please go on.
No, go.
Please go on, Jenny.
Oh, just with people that I've met and talked to, especially those that are working, that are still in the working field. That's one of the hardest things for them to explain to an employer. And so many times I've seen, especially with men, young men, that they say, I really can't do it. It's too much, or the heat is getting to me. they're dismissed. They're treated very poorly. There's not the understanding of what this disease can do and does do to each one of us. And I think that's one of the hardest points to get across to any employer, that this is real, that the tiredness is real, the heat, the whatever is real, and that these people need help or some compensation so that they continue to work and earn a living and feel good about themselves.
We do have a raised hand. Diane, let me just see here. Participants, just go in and. Diane, I'm going to allow you to unmute and talk.
Okay, great, because I can't find on here where to unmute, or I don't
Okay.
see that I'm on here, so I just want to know if I was here or not. I don't see me on here.
Yeah, you're here with us. None of the attendees are able to see themselves online, so your camera's not going to work on this webinar, but go ahead and, did you have a question you needed to address to the group?
No, I just came in, so I don't know exactly where you all are. I just knew I couldn't see if I was on here or not, or even if you could hear me. So if
All
that's
right,
fine,
I'm going to
but
lower your hand, and if you could please just mute yourself again. Okay, thank you. Getting back to the invisible symptoms and the one-upsmanship or the people not taking you seriously. Jaitrali, you started to say something as Jamie was talking, so I'll let you finish your thought on this.
Sure. So I have had difficulty right from the time that I was diagnosed with MS and Crohn's. In fact, MS I was getting symptoms in back in 2006, but by the time I was diagnosed, it was 2009. And soon after that, I had got Crohn's, and I used to rush to the loo 19 to 20 times in a day. I used to pass blood and mucus. I kept on going back to the doctor, my neurologist, several neurologists, and everybody used to tell me that it is because of MS, because it is a neurological disorder. Your brain is sending wrong signal to your body, and it is asking you to go to the loo, so you are passing motion. And I refused to believe it, because 19 to 20 times undigested material, mucus and blood, it was not normal. And I I believe each one of us understand our body, which can be related and which is standalone. And I had to literally push the doctors to tell that, take an endoscopy or a CT scan. And coincidentally, I was admitted to take my solimetrol. At that time, I did my endoscopy, and to their surprise, they found that my entire intestine, small intestine, was full of ulcers, and that was bleeding. So they don't believe, and they all blame it to MS, to what you have, and they will blame it on your brain that, okay, it is sending wrong signals. Second, I got psychosomatic asthma in just a few months back, and the doctor tried. I have asthma as well, and we were treating is at two. I mean, treating is as the same, but there was one shortness of breath and there was an asthma. The shortness of breath was the psychosomatic, any kind of trigger, good or bad, overwhelming. I start getting shortness of breath. I find it difficult to speak, and my oxygen starts dropping. So the doctor just gave up on me. The doctor just said that, nothing can be done, so you go back. The only thing that
Jaitrali,
Yep,
we need to keep these answers really, really tight, short, 30 seconds. So,
sure. So
so,
I'm
so
over with
we need,
this.
all right, we need to move on for just a second. I'm seeing a lot of questions popping into the chat. If you have a question that you want addressed by this panel, please put it in the Q&A. We are kind of leaving the chat just for very casual stuff, not for questions that are going to get answered here. The other thing is we're focusing on invisible symptoms here and one-upsmanship in this question, not a back history of what we physically experience or visible things that are going on. So I'd like each of us, if we can, to stay very tightly to the question that's being presented. I think that the things like Jaitrali was just talking about with other symptoms, we often get bundled and taken not for, taken for granted that everything is MS related. Everything is not MS related. In fact, it's not unusual, as Jaitrali was mentioning, for people to have more than one autoimmune disorder at the same time. And oftentimes that muddies the waters because symptoms of Crohn's or rheumatoid arthritis or lupus or MS might be mistaken for each other. So if you've got a doctor that is routinely telling you that it's all in your head or that it's psychosomatic or whatever, you need to find a different doctor. You need to get another opinion on something, because a lot of times these invisible symptoms, fatigue is a huge one. People will often say, oh, I know what tired is. And, MS fatigue is very different from tired. It's it's a lassitude. It's like, I like to say it's like the starch has gone out of my spine. Um, I can't hold myself up. My spine has become a rope. So, I think that those sorts of things and the one-upmanship. Do any of you have a way of addressing the one-upsmanship, people trying to make their invisible symptoms when they don't have a chronic illness akin to yours that might be helpful?
I think for me, what I do, it's just like some, that feels like one-upsmanship and just like knowing who the person is. I can tell if they're doing that, but other times it's like sometimes then it gives me the opportunity. I just like to step back then and make it less about me and then just listen to their problems, their concerns when they say, "Oh, I know fatigue." Well, then it's like, okay, well then tell me about it. And I mean, and it's just like then what I guess what I like about doing it that way, then it becomes it it makes it not about me, and so then it's just like I think that it's like then I can be worried about them, and I think really it's just like, are they just trying to engage in the conversation with me? And I think, for the same token, I don't want them to one up me. I don't want to one up them and undermine their issues and concerns, because on some levels, let's be honest, it's not a competition, because reality is we all would win, right? So I just think in terms of
Yeah.
that one-upsmanship, it's just like, getting it out, putting myself in the place that I want them to be too. So I think it's like making it less about me, unless it totally has to be about me. Then it's just like, okay, this is Dan's time. I need to talk. So.
Diane has her hand raised again, so go ahead, Diane, and unmute and ask your question. Diane?
Oh, sorry. I've been talking. I thought I had taken it off.
Oh, no, you raised your hand again, so let me lower your hand. I would ask folks to please, if you could, unless it's a question related to something one of the panelists has said that needs to be raised in real time, if you could hold your questions, tick them into the Q&A, hold them until about, oh goodness, about 5:15.
Well, you
And
know what? I was gonna respond to what that is, but I don't like the way how this session is going with people, how you cut them off and how you only have a few seconds for this, a few seconds for that. I was gonna respond to the last two part, but you guys go ahead and maybe I'll join you another time. We'll see.
okay, thank you. Could you remute yourself, please? I know Didi, you mentioned fatigue in your talking points too. Is there something that you wanted to add to that?
Sure. Thank you, Cherie. So, I do often talk about like fatigue, like among my family, friends, and colleagues, and I think it's just like having a mutual understanding of what fatigue is for me, I suppose, because I know, like, to the average person, when they look at me, they see, oh, she looks normal, she doesn't look tired. And it's, I guess, more than meets the eye, because when you see me, of course, like you see, oh yeah, she's talking fine, she's normal, but it's to me, it's how like I feel inside. And sometimes like I'm the type of person I don't like to show like my fatigueness, but I always explain to like everybody that like sometimes I cannot make events. I have to sleep in, I have to nap because like our fatigue is completely different. It's like I like to describe as getting hit by a bus. Some days when I wake up, I can't even open my eyes because of how tired I am. I can't even lift up my hands, and I'm pretty sure my peers on this panel can attest to that how our fatigue is. But with like I like to educate my family, my friends, my colleagues, and also my peers about it so that they can have a better understanding of why like and how like of why I can't go out to events and why I'm tired, and also they can have more knowledge about like the type of fatigue that I'm feeling as well too.
Has anybody ever had any sleep studies done to kind of try to figure out why the fatigue is a problem?
I I have. I had
You
a
have.
sleep study done because originally my neurologist thought I had sleep apnea. Maybe that's why I was getting tired. But no, like they didn't find any sleep apnea. So it's
Yeah, more than half of us, which is quite a bit larger than the general population, do have a diagnosable sleep disorder. So people for whom fatigue is one of their major symptoms, we recommend that you get a sleep study done to see if perhaps it is sleep apnea that can be treated, and that sometimes helps the fatigue. Are there are there any tips on dealing with fatigue that any of you have found to be helpful?
I haven't quite, truthfully speaking, I haven't had anything that has really helped with my fatigue, and that is my or one of the worst symptoms that I undergo with the pain, and especially the nerve pains and the fatigue, and it is very difficult to understand. Uh, I call it local anesthesia when the feet, your legs get heavy and things like that. I try to give it a name. But yes, fatigue has been, and even insomnia. I have tried in the sleep apnea machine as well. It didn't really work, and sleep is a big issue along with fatigue, which makes fatigue even worse the other day.
Anybody else?
Well, I think for
Um,
me, it's just
Go
lots
ahead.
of well, it's lots of coffee, right? And that just opens the door for another MS symptom with, our bladder issues. But I think
Yeah.
a lot of times, I think as far as fatigue, it's just taking that, 10 minutes to just stop. I mean, it's just like, and that's where it's just realizing that, we're not the only ones. It's like anybody, whether they have MS or not, sometimes you just need that, 5, 10 minutes to just stop and give yourself that break and just recharge at least, to make it through another hour, to make it through another half hour. I think it's just giving yourself the grace to stop and not feel bad about it. I think that's how I push through a lot of the fatigue, and then just look forward because how many hours till I can actually go to bed, and tomorrow will be another day.
Barb,
I oh
Barb, you started to say something?
Uh,
No?
didn't think so, but couple of things that help me is I need a nap every day. If I don't get a nap every day, if I go 2 days without a nap, I don't like to be around myself, much less having anybody else be around me. So taking a nap every day is something that I need. I agree with Dan that if I drank enough coffee to make it through the day, I'd just be getting lots of exercise, going to the bathroom. So I don't do that. There have been a couple of times that when you hit that wall, there's nothing you can do. So I would look at my ex-husband and he would say, well, just finish this or just do that. And it's like, I can't do that. And unless you're going to pack me out of wherever we are, I need to get to where I can sit for a time. And sometimes that means I need to just put my blinders on, doesn't matter where I am, what I'm doing. I need to get to where I can sit and take that 2 to 10-minute break. But that's what I have to do. So
I find that sometimes I'm not aware of how warm it is, even though I'm very heat insensitive. And if I can cool off, sometimes that helps the overwhelming fatigue. And sometimes, an extra glass of water or a can of seltzer can really help to lift that a little bit. I think many of us forget that hydration and temperature really impact the intensity of the fatigue that we're feeling. Dan, you said something about MS being deemed as a rare disease. It certainly was when we were diagnosed. I mean, for years we kept hearing that there were about 450,000 people in the United States with MS, and now we know that we're well over 1 million in the US alone, and that there's probably closer to 3 or 4 million worldwide. I think your point there is that more women than men have MS. That was one of your talking points. Do you want to elaborate on that?
As far as, I mean, just, as far as more women than, well, obviously look at the panel right here, right? There's one guy. I think that's, but I think that's, when you're talking about the fatigue and, and just talking about invisible symptoms and stuff, I think that's just something where, it becomes more challenging to like find, to find other people like me, who understand the disease. And so then it's, I think that's just, the one thing that I'm always, I mean, there obviously, yeah, there's lots of men, but at the same time, there's, when you're talking was like 3/4 or 66%, this a sizable majority are women. I think that that's where we just have to talk about, levels of when we're talking about fatigue or invisible symptoms. And I think sometimes, I don't know who said it earlier, it's like, if you're a man, do you get as much sympathy at work, or you should be able to do this. And I think is that something where, and that's not to say that, men have it more difficult than women, but I mean, are there just different expectations for men, if as far as physical labor. I mean, we had my family, my sister and her husband were here this week, from Iowa this past week, and there's just things I can't physically do anymore. If I, and so then it's just like, and I should be able to do that because quote unquote I'm the man, I should be able to do it. And it's like, no, I really can't. But there's, I think so there are things that maybe as, and that's not to say, oh, men versus women, but I mean, as a man, there's just certain things that you really have to do a better job hiding, or things because people don't understand that level, when you're dealing with a man. I mean, there's so many things that, Jennifer, my wife, has a caregiver that's here during the day while I'm working, and there's just things that she does to help us because I just plain can't do it anymore. I don't have the physical stamina to do it because of the MS, but it's just like, partially things that I would be embarrassed. I mean, obviously it's going out here in front of the world, but I mean, just, guy friends of mine to say, well, I can't do that. There'd be like some things that's like, well, you should be able to. And it's like, I know I should, but it just, just how that just changes when you have MS and people can't see it.
I think you brought up a good point with the sort of maybe trying to hide or get around, particularly in the work arena, the things that your employer or your coworkers don't see that are difficult for you. And I'm wondering if any of you have found ways to deal with that.
For me personally, at my work, I'm very transparent about my symptoms. I'm pretty much an open book. So I'm very like transparent. So I always say to my coworkers, I'm like, hey, I'm tired today, or I can't do this. And I know like some people like they aren't comfortable with that, with sharing like their symptoms or how they're feeling. But for me personally, it helps me because I feel like it could help them understand like, oh, Didi's not feeling well today. Maybe I shouldn't bother her. Or Didi is like really tired today, so I'm going to let her take a nap. So I'm very fortunate that my workplace is very understanding and and they support me, and so they know how to, I guess, what's the word, sorry, I'm having cog fog right now. So um they I want to be more transparent so that they can understand like what I'm feeling, what I'm going through, so that in terms that they can, I guess, know how to react to it.
Thank you.
I had
Jamie.
a completely different, sorry.
I'm sorry, Jamie first and then
Yes,
Jaitrali.
sure.
No, I was just gonna add on to that, that I think that's true, and it's up to us as individuals to let people around us know what we're feeling and what we can do and what we can't do. And I think men are worser at that, where they don't let people know, because again, you have that macho-ish thing and you think you can do it, or people think you can do it. And that's the hardest part with the members of our group, that they talk about the men that, you know, they just can't do it, but people don't understand that they can't do it. And it's really up to us to let people know we can't do it. We really, really can't. And not to push us and not to make us feel ashamed about that. And that's hard to get through to people, to even your own spouses or partners. You know, there's things you can't do, and you got to let them know you can't do it so you can accept. It's learning how to accept help, I think. Maybe the grace, give the grace to others to help you help yourself. And that's a hard notion to get through on any level,
Thank you.
especially in
Jaitrali?
a workplace.
Yep. Jaitrali, what were you going to say to this?
I was saying it was completely different from me because in India, the awareness is very, very less. There is very less, there is a huge lack of awareness about autoimmune disorder, forget MS. They do not understand. Like Didi said, that I was also very transparent right at the word go. I had taken a sabbatical after I was diagnosed, and post that, when I again joined back, I had been completely transparent, but they had a problem taking me to the meeting when I was limping, and that is the reason. That is one of the reasons why I was in a CXO position. I had to give a premature retirement. I had to take a premature retirement, telling that I cannot do it, but I wanted to prove it. I studied psychology, and that was almost like my willpower and my grit, that I am not incompetent and I can do it much better. It's just that you all do not understand what we are going through and how.
Thank you. Anybody else want to weigh in on that one? I see we've got some questions in the Q&A. If you wish to ask a question, please put your questions in the Q&A and not in the chat. We will hopefully have the chat free for anybody that is on Facebook and wants to ask a question on the Facebook live stream. So Sunny says, what is the best way for friends and family to ask how you're doing? Or rather, what is the best way to stay connected without being overbearing? Anybody want to take that question?
Sure, I can. I think the best way is just to listen and just uh I guess give us grace. So like sometimes it's hard for me personally to convey my feelings because I get the cog fog, or I know what I want to say, but then like it comes out like a totally different way. I think just having grace and just listening to us. And sometimes I just want to vent. Like I just want somebody to vent to. I just want to like express my feelings. So I think the way is just to listen to how we're feeling.
Thank you.
I can add to that very often that when we try to complain or when we are trying to make our near and dear ones understand exactly what you're feeling and that it's not similar to how we felt yesterday, the first thing that comes is advice. Why don't you do this, or why don't you do that? And which are most often impossible for us because we know what we are trying to say is completely different. So what we want actually just, yes, as Didi said, that we just want to vomit out sometimes. We just want to understanding that you won't understand the pain or what we are going through, but just sit down, just be with us, just a soft cuddle, just a soft hug. I think that is more than we need. We don't need advice because we understand ourselves more than the caregivers or anybody else outside us, around us, or start creating boundaries when you cannot take certain questions. Like if you are asked, like, why are you wearing a heel on a wheelchair? I said, it doesn't matter, I'm on a wheelchair, even if I wear a heel. So I've started creating boundaries over there. Those things really hurt you. It tricks you. And so the only thing that you can do, either create a boundary or stop them. As has got more than enough, and now ChatGPT has got more than enough information to give to you. So don't ask us.
And I chime in that we understand that like you don't understand. So we do. So we understand that.
Yes.
Go ahead, Barb.
Well, for me, sometimes I don't see my family members for a year at a time. And in that year, things have deteriorated. And so they ask how I'm doing. And it's like, hey, I have a progressive disease and it's doing what its job is. It's progressing. So I'm fine. Just, and the other thing, there are times I'll be walking through a restaurant, things are a little squished, and so sometimes my friend says it, sometimes I say it. You just look at the person and say, be prepared to be mauled because I will touch your shoulders as I'm going by. Nobody's ever said, ew. They all, oh, okay, no problem. And sometimes they enjoy it. So, and the other thing is often my friends or other people want to help me, but they don't know how, or they'll stick out their arm and, well, I prefer your arm to be this other way, and I'm in a little bit of control. But the thing is, people don't know how to help you unless you show them and tell them. And then they feel good because they can help you and they know they're not hurting you. And so that helps them feel good. It helps me feel good and kind of educate people at the same time. So that's how I deal with stuff.
Excellent point. Jamie, you were going to say something?
No, just add on to that, just communications is the biggest thing. I like bringing like the MS Focus magazine. I'll bring that to people or leave it in an obvious place where they can look at it on their own, and they might see different articles that might catch their interest and might relate to me or other people that they know. So I think the more education, of course, the better, but the more you speak up about yourself and what you need, being assertive, you know, is not being obnoxious. It's just, this is what I really need. And
Yeah.
if you can help me, fine. And if you can't, I understand. But you've got to let them know so that they have a place to put their energy, you know, towards helping you.
Very good. The next question, an anonymous attendee asked it, do all of you take MS therapy drugs, and if so, which ones?
I don't anymore. After 70, I
Right.
was given the option not to, and I
Yep.
took the option, and I'm okay. And I'm 78 now, so.
Okay.
My story is similar. I was started taking Tecfidera as a clinical trial, and it eventually became Vulmerity. It's an oral medication. And way back when I had to shoot myself weekly, give myself a shot, I hated it because I knew I was giving myself the flu. And that's exactly how it felt. I used to call it hangover day because it just was not pleasant. Where the oral medication, I felt the same all the time. There was no highs or lows. But again, when I turned 70, the neurologist said, yeah, we don't usually have people take MS medication this late in their life. So,
You know, that's one of the things that a couple of you brought up is when to stop. There's a lot of emerging research right now that says that if you've been on one of those earlier medicines like the injectables and you've been free of any progression or new lesions on your MS, you may very well be able to stop your medication. And yet, even after the age of 60, people that have been stable for 20 years, about a third of them will have new disease activity or relapse once they go off their medicine. But even those that are staying on their medicine with those older injectable meds are doing the same, about a third of them. So statistically, it's not much different. The real question comes in, I think, when we're on something that's newer and maybe more effective, like the B cell drugs like Ocrevus or Rituxan or Briumvi. Those drugs, there's new information that was released this year that is showing that in women particularly, they, after the age of about 60, have about a 3-year good window on those drugs before they start having side effects that things like their immune globulins dipping or colitis increasing or things like that. So they do need to be monitored, and our immune systems slow down after about the age of 60. For most of us women, particularly by the time we're through menopause, or about by the age of 55 or 60, our progression now meets the same rate of progression as our male counterparts. So we're pretty sure that estrogen does play a role in that. Dan, were you going to say something?
I was going to say there's that the male female differential again, right? So But because I was on the beta seron for 20 some years, and I had to stop taking it because I couldn't get the injection in anymore. And so and actually then I go in for my Ocrevus tomorrow, so I'm looking forward to a day off of work, right? But I think it's just but I'm 52, so I mean, just as long as I'm still doing it, it's like I'm not ready to like stop taking it because I'm just like, well, I'm just 52. You're talking about like once you turn 60. Well, but I think it's just like one of the things I can do to like slow the progression, or at least mentally, that's I'm doing my part. So
And Cherie, so I'm on Mavenclad. So I used to take Copaxone 3 times a week. I hated it because the injection sites were always swollen. And then I tried to switch over to Ocrevus, but I had an allergic reaction to Ocrevus. So then I was put on Mavenclad. So I take 2 dosages a year apart. So that's the therapy I'm on.
An interesting fact, a lot of people think that they're allergic to Ocrevus or the similar drugs. Almost everyone on the first infusion gets an itchy reaction and has to get a little Benadryl or something to kind of stop that. It's not an allergic reaction, and most of us following that first reaction or infusion have no further reaction. I thought that I was allergic at first too, but I never had another reaction after the first infusion and was able to stay on the medication for 10 years and then transitioned after I hit 70 to Mavenclad. And I finished the second year of Mavenclad, so hopefully I'll never need anything more. Jaitrali, other than steroids, are you on anything now? You're muted, Jaitrali.
Yeah, I have been on rituximab. I've already been given 4 shots, and it has not made any difference as of now because the doctors say that the ailment has aged a lot and not much that can be done right now. So even I have progressed from RRMS to SPMS right now. And rituximab has been giving me a lot of side effects, and the symptoms are to take MS symptoms, and then after the rituximab, it was very difficult. And it didn't work on me at all. In fact, things deteriorated.
Yeah, there's a fallacy that these drugs are going to make us better. They don't. They
Yeah.
merely stop us from getting worse as quickly. So, I mean, there are a few of us that do see some improvement on the drugs. I personally was one of those people that with a couple of the meds that I took, I did get a little bit better. It calmed the severity of the symptoms. But I think sometimes we go into these medications with some unrealistic expectations that it's going to shift the way things are progressing. Stacy says, how do you deal with symptoms that are things you generally don't feel comfortable sharing? Things like sexual, bowel, bladder, emotional symptoms. When people ask you about your disease, a lot of hidden symptoms are hidden because they're highly personal. But I want people to take seriously that I'm dealing with things.
Can I take it?
Please.
I have been on wheelchair past 3 years. I have had bowel control. I still have. I do not, I'm on diapers. And initially, yes, definitely, it was very, I used to feel ashamed. I used to feel shy to go out. How would I change? How would I be able to take? It's like, a baby going around. But I think the best thing is to be transparent, even about whatever symptoms that you have, because only then will the others be able to understand the intensity of the disorder that we are having. So shying away from it, yes, initially you do, but over the time, first time when we take to wheelchair, we do get conscious, but over the time you get used to it. And it is, I believe that the more transparent you are to people, the more you are helping them to try and understand you a little, if not full.
Thank you. Susie says, I have equilibrium issues, especially when it's hot. Things like fluorescent lights, overstimulation in crowds also cause problems. Does anybody experience this, and explain to others how it's not as simple as just being in AC or putting on sunglasses? No, maybe not.
I think all of us have problems in heat. But I asked my support group to tell me about some hidden things that they have problems with. And one of them wrote that when suddenly the lights go off, the electricity, is off or whatever, and it's suddenly dark, she cannot handle it. She says she has to stand on a wall, just right up against a wall. She has flashlights everywhere in her house just to make her feel better. But she said she is almost frozen and cannot move. And I thought, well, that's kind of weird. I've never read anything like that. And another in our support group said she basically has the same problem when there's a little bit of light and then there's nothing. She said she has to get down on all fours. She just can't, they just can't stand being in the dark. And so I just wondered if anybody else had problems like that.
I do. I
Oh,
know I
okay.
do. We went to the movies a couple of months ago. We don't go very often, but we walked into the theater just as the film was starting, and they shut the lights off. Just they all of a sudden turned the lights off instead of dimming them, and I still hadn't found my seat, and I literally had to stand there for a minute and just couldn't find the seat at all. It took me several minutes before the light from the screen was able to adjust. I think sometimes on some of those sensory things, we just shut down and it takes us a moment to reset. We freeze. And that's not uncommon. I'm hearing more and more people saying things like that. So, if you've got somebody in the family, or if you yourself are experiencing that sort of thing, don't hesitate to communicate that to other people.
Yeah, I in the dark too. Like I have balance and coordination issues, so I constantly bump into walls, knocking over things, to a point where like what really helps is that my husband installed motion sensor lights. So anytime I walk, like the lights will like pop up. So
Good husband. Me too. Robert says, my wife thinks that since I take chair yoga at the sports center, I should be able to do any of the work at home that's mine, like the cooking or the laundry, etc. Okay, go for it.
Take time. You can probably do everything, but somebody else has to have the patience.
Anybody else? All right, Lindsay says, is it helpful to be there and ask, what can I do for you, or how can I help today? I think that harkens back to the question we were asking, how do you inform people or educate people? So Lindsay wants to know if it's helpful to hear that. What do you need today?
absolutely.
It's always more helpful that they ask
Mhm.
ahead of time.
Mhm.
What can I do for you, rather than coming in and doing it for you, or, or I'll do that. You know, you don't want to make somebody feel that they can't, I don't want somebody to feel they have to take over for me. I know what I can do, what I can't do. But it's nice to have somebody, it's really nice to have somebody say, is there anything I can do for you? Let me do that part for you. So asking is always kind and good.
Mhm.
And I think that puts a lot on, I'm thinking for me, not speaking for everybody on the panel, everybody with MS, but I think a lot of this comes into how do we as people living with MS portray ourselves and stuff, because I don't want just a coworker or somebody just randomly coming up to me daily say, what can I do to help? What can I do to help? Because nothing's going to make me more upset than that. But at the same time, my sister's here, she knows, or like Jennifer, they know it's like I'm going to do, but until that point, then if they say, do you need help? And it's just like knowing how to communicate and how to be open with that. And I think that's the thing for me is I don't give MS more credit than it deserves, because I don't want the same reason as we talked earlier. I don't go to a new doctor and tell them I have MS. I want them to figure out on their own what my symptom is rather than chalking it up to MS straight out of the gate, because maybe it's something different. So I think it's that, and just being more protective of, I have an invisible illness on some levels. I embrace the fact that I can fake it till I make it or hide it. I don't have people doing that, but at the same time, I need to be careful or just be picky and choosy over who I let into that circle, because it's just the reality is I see that, other people are dealing with a lot of the same stuff that I'm dealing with, and they don't have MS. So it's just like, I'm just like everybody else on some levels. I mean, certainly they don't have the fatigue and stuff, but it's just like, I want to at least make sure that I'm doing as much as I can to hide the disease, but just let the people who need to know in on my little secrets of what needs to happen and when I need help, because otherwise, then the people who aren't in the know are going to judge me based on everything, just quote unquote, because I have MS. Whereas otherwise, they're not going to notice it, because I'm just like anybody else. Like when I used to work on campus here at Central Michigan University, I'm walking across campus with other people, my legs are tired. Even though my shoes were perfectly tied, I would stop and kneel down because I had to tie my shoe. They didn't need to know that, oh, I have MS. I'm tired. I need to stop. It's like, no, I'll fake it, because everybody, whether they have MS or not, their shoes come untied. So it doesn't make me different, thereby then not giving MS more credit than it deserves, because sure, MS was why I needed to stop, but at the same time, I don't want to be judged and labeled that way. And so from that standpoint, there's certain things about MS that I embrace the invisible symptoms of things, because then I can hide it and not be judged on the disease alone. So,
Coping strategy.
yeah,
Thanks for
very much
sharing that.
so.
An anonymous attendee asks, does anyone get brain freeze without drinking anything cold? I think they want to know that they're not alone
All the time.
all the
All
time.
the time.
All the
Must be
time.
all that sugar, Didi.
Oh yeah, I think so too.
Maria says, does anyone have itchy palms or feet and have issues with too many noises? How do you
Yes,
combat
I
that?
do. I
Okay.
do have. The itchiness, it takes us time. It takes time to go. Sometimes there are rashes, sometimes there aren't. It is just itchiness. It takes its own sweet time, sometimes a few days, sometimes one day, sometimes a week. That is quite common in many MS patients and clients that I have seen. The second thing was, I'm sorry, she asked two questions.
How do you adapt to it? Was
So
the
the
second part of
only
her
thing is
question.
that there are certain creams that are given to you, like lactocaramina, that those that do not have chemicals and they just, make your skin a little cold. So you need to keep them in the refrigerator and just put them, and it goes by itself. And just put some cold water at times. That should be it. Don't go for medicines because that is another added
Yeah.
thing to these
Yeah.
are all common things. It just come by itself, and go by itself.
Yeah. We're getting right towards the end of the hour. Linda is asking, cognitive changes can be subtle but difficult. How can families recognize and adapt to these changes in daily life without frustration or resentment building up?
I think just knowing, like, for example, for me, like knowing that, like, sometimes, like, I sometimes I would lash out, but that's not normal of me to lash out. I just think seeing like signs or symptoms that are like out of the norm, when you know like how that person is. Like you could tell, like, oh, this person's lashing out, maybe like, something's wrong, or like maybe there's like a symptom of MS, I think. And I think just like what I've been learning is just like reading more research as well too, like maybe like the cognitive signs decline and like symptoms of like MS as well too.
Yeah. Also with cognitive changes, some of the MS practitioners, some of the docs that we're seeing are routinely getting a neuropsych workup at the very beginning of our time with them. Certainly, it's something you can request. I had my first neuropsych back in 1996, and I haven't had any follow up on it. But my doctor just said, I think since it was 1996, we probably ought to get another baseline. So you're certainly within your rights to ask for neurocognitive testing, because I know back in 1996, the results of that neurocognitive testing really helped me to get a cognitive rehabilitation program in place that allowed me to stay in the workforce a little bit longer. So let's see. All right, we've got, let's see, Robert. Oh, Chris for 4 years. A lot of these are just comments here. And I think we have time for one actual real question. Brooke says, what kind of exercises do you recommend? What is recommended is at least 30 minutes of physical activity every single day. And you want to be doing a mix of stretching, which will help your spasticity, strengthening exercises, and aerobic exercises. And there's all kinds of research that has been done in the last 5 to 7
Even
years now
yoga helps.
that's really showing us that exercise is the single one thing that helps severe fatigue across the board. It works way better than any of the medications you can take for fatigue.
Cherie,
Yep.
since we have come to the end of the session, I just have 4 small points that I wanted to, or rather it encouraged me when I talk to myself. So can I just put down those 4 points, just
Sure.
small points across? So I believe that just because you can't see it doesn't mean it is not real. Second is validation is like medicine. It takes a whole lot of burden from us since we are talking invisible. So that validation from our caretakers, from the doctors, from our near and dear ones, I think it works like magic. The third is the invisible creates loneliness and that leads to depression slowly. So we have to cut down the isolation. We have to make the patients feel comfortable, feel validated, and only then they can come up with more problems that they are probably facing. And the invisible, what we say is that we are imagining it, we are not imagining it, we are enduring it. So these are the 4 points I thought I would put across as.
Okay. Does anybody else want to say anything more on this before we end the webinar?
I think two things. One is if you're not comfortable with your neurologist or your doctors, find somebody you can talk to. Somebody that will listen to you and not just sprout out the usual about. And I found that with a bunch of our people, you have to shop around a little bit. That's okay. Go do that because it's important that you are comfortable so that you can talk about the invisible even to the doctor. And also to keep your friends and your family well informed about who you are and what you are going through. Invite them to go with you to the doctor. Let them be part of your life. Don't cut them off. Don't try to be brave. It's not a time to be brave.
Thank you.
And
That's it.
I have like two small points too. And one is to definitely advocate for your own health, because there are many times where I've been to doctors, they would dismiss my symptoms. Oh, that's not it, that's not it. But definitely you have to be your own advocate when it comes to having like MS or any other autoimmune disease. And second, like it's okay to not be okay. Some days you're not going to be okay. And you have to give yourself grace and kindness over that as well too. And know that tomorrow is a new day. Tomorrow you're going to give it like an extra 20% if you can. So
Thank you.
Good one.
Dan or Barb, do either of you have anything that you want to leave folks with?
I mean, I said stuff earlier and I have a hard time topping what everybody else just said. I think it is just, but I think the fact that everybody that's that attended the webinar and is like seeing things, watching it, is like the fact that you're doing this and watching and participating shows that, just keep yourself out there, keep yourself active, and don't close yourself off. I think I always joke that, I say that I didn't have MS and I use it as a way to pick up chicks. That's how I met my wife. But it's like, none of that would have happened had I just stayed by myself. I'm not saying you're going to go out and find your soulmate, but I mean it's just being out there, staying connected, staying involved with this community, with MS Focus and stuff, just to stay, because you're not alone.
I involved with the chair yoga exercise class. There's a whole bunch of the exercises they do that I can't. They just end up being more arm exercises because I have to use my hands to move my feet. So, but there's other things I can do. And so in a lot of ways, I go for the social benefits of the class. And I know there's people in the class that might not be there, except for they look at me and go, well, if she can do it, I can do it. So that helps too.
Thank you.
Yeah.
Thank you, all five of you, for sharing your wisdom and your journeys with us today. Our next event is going to be Tuesday, July 22nd, also at 4:30 p.m. Eastern Time. And it will be a panel of individuals sharing their experiences as it's the Black MS experience. We know that persons of color tend to have often a more aggressive course of MS. Women of color right now are the largest demographic currently being diagnosed. So there are a group of people who are going to share some of their experiences with diagnosis and managing their symptoms. And that will be next Tuesday, the 22nd of July at 4:30 p.m. Eastern Time. For those of you who've joined us on Zoom, when the conference ends, when the webinar ends, if you just stay on the line for a minute, there's a quick survey. If you wouldn't mind answering a few questions to sort of help us tailor future programs, you're welcome to critique us on our presentation. Tell us what we could have done better to meet your needs, and we thank you for that kind of input. If you had questions that didn't get answered and you really need them answered, feel free to reach out to me. My email is Cherie, that's CHERIE at msfocus.org, and we'll try to get you answers. And if you need to connect with a specific panelist that's here today, I'll try to connect you as well. Thank you so much, and have a safe summer and stay cool. Take care.